So here's what you see after smoothing off the flaps that were hanging off the femoral groove. And the patella, again, is still being pulled laterally. We may be releasing that because it's pretty tight over there. As they come here, I took out the synovial plica that was pushing hard on the medial side of your knee. If you put the right hand on the right side of your left knee and pushed in, that's where we're pushing from the side here. We're coming down here where the MRI showed, hold the probe here please, where the MRI showed a meniscus tear. And this is the top of your, hang on, this is the top of your leg bone, the top of your leg bone down beneath is the tibia. This is the end of the thigh bone, the femur. This is an area here where you have some defect and some wear in this area down to a real tiny little, maybe a small little millimeter or two of exposed bone, but these edges are pretty stable there. When I look back here, this is the meniscus right here. It looks okay towards the front, a little bit of fraying, but we get towards the back and I can magnify here. This is the tear that we're seeing here, contributing to the pain that you're having. And let me get a picture of that there. So I'm going to have I have a shaver and a biter instrument to go in there and trim out that torn, unstable portion of the meniscus, leaving as much of that cushion behind as we can. Can I see just the number 1 biter? And sometimes we have to use angled things to get back here, but I'll use this kind of like a Pac-Man instrument. I don't know if you can see that. That opens and closes. And we start trimming away this torn portion of the meniscus here. And then we put a shaver in there to kind of chew out the pieces we're creating and kind of go back and forth, and I'll probably switch the shaver over to the other, or the biter to the other side of the knee to get a better angle at it. But this is the part that'll get me the angle on this part in the very back here, because we need to have a smooth transition to where the remaining meniscus is. So I'm going to keep working on this, and I'll take a picture when it's done so you see what you have left in the way of meniscus towards the back here on the medial side of the knee. And I'll turn this back on in a little bit.